Hi, everyone. Welcome. Welcome to our cancer education series. I'm Dick Deming. I'm medical director of MercyOne Cancer Center and founder of Above and Beyond Cancer. This cancer education series is funded in part by a grant from the Iowa Cancer Consortium. And tonight we're going to talk about chiropractic care. So welcome our guest, Dr. Blake Myers. Blake is an Iowa boy.
Yes,
Grew
sir.
up in Jewel, went to high school in Jewel, went to the University of Iowa. So when you started University of Iowa, what was your first major when you first started?
You know, in fact, I only had one, and I went through the biomedical engineering program over there.
Okay.
Yeah.
And then chiropractic school
Yep.
at Palmer
Yep.
in Davenport.
Yes, sir. Yep.
And Blake has been in practice as a chiropractor here in Des Moines for the last 10 years. And I've gotten to know Blake really well this year because of the MercyOne Cancer Center. We have created an integrative medicine program, which brings chiropractic care actually into the cancer center. So we're going to talk about what is chiropractic care and what's the role of chiropractic care in cancer care for patients. So before we get into the nuts and bolts of that, how did you decide to go become a chiropractor?
Yeah, so for me, it went back to high school. Seemingly, a lot of the people in this profession have some chiropractic success story that they experienced. For me, it was involving a stress fracture in my low back from high school football that just seemingly never healed. And then finally, when kind of the orthopedic group cleared me to kind of do whatever, return to all activity, I dealt with it for years. And found a chiropractor after about 6 or 8 years that kind of finally took care of the issue. And I haven't really had much problem since. So that was kind of what got me started on that path.
Good.
Yep.
And so thinking back to when you first found a chiropractor to work on you, what was the process of you seeking out a chiropractor, you finding one and figuring out how that care was going to proceed?
Yeah, that was my first introduction that chiropractic wasn't uniform everywhere. I had grown up seeing a chiropractor just off and on, kind of when your typical person would see one when they need one, but just one provider, my entire youth. So for me, that was the profession. And so when it came time to kind of explore this back issue years down the road, I had sought a second provider. And that was my first experience that there's a wide array of approaches. And it was that second approach that really worked for me.
Yeah.
So,
and then what year did you start chiropractic school?
2009, in fact.
Okay.
Yeah.
Okay. So obviously in this millennium, and how would you say, from what you've learned from what chiropractic education used to be to what it is now, how do you think the profession has changed over the course of the last century?
Yeah. So currently today, the profession has made a huge effort to modernize, integrate, bring in a lot of evidence-based approaches. The largest research institution for chiropractic is over at Palmer College, where they work on or work with millions of dollars in research funding to bring in as much evidence and best practices into the profession that they can.
Yeah. And what's the education program? Is it a 4-year?
It is. Yes, it is. It is a 4-year program, and it is always followed by an undergraduate program as well. Yep.
Okay. And as medical doctor, the curriculum didn't change a lot in medical school for a long time. First 2 years were often classroom, and the third and fourth year where you actually got to take care of patients. Is it similar in chiropractic school?
It's very similar. You start out with about 2 years of what they call the basic sciences, and where you'll see the primary difference between a lot of the medical programs and a chiropractic program. Chiropractic program really focus their training into a lot of the anatomies. So a lot of anatomy, maybe compared to a medical school, maybe less of some of the physiologies that you'll see in medical school, just because it's a very structure function based approach. So spending a lot of time in the nitty gritty of the anatomies.
Yeah. So you talk about structure and function, and so that's kind of what I think of, and I'm hoping you're going to enlighten me and our audience. I think of mostly musculoskeletal
Yep.
system, but obviously also the way the nervous system integrates
Yes.
with musculoskeletal.
Yes.
I think of what you do less having to do with the gastrointestinal system, and but maybe tell us a little bit about the theory of the way that chiropractic treatments provide benefit.
Yeah. So the foundation of chiropractic is exactly what you said. It's the neuromusculoskeletal. It does focus heavily on the neuroanatomy of the body, how the brain is kind of the controlling system of the nervous system, and how the nervous system then controls the rest of the body. So a lot of the focus is on the specifics of neuroanatomy, where those nerves are going, what they are controlling, and how we can maybe be good detectives in establishing what is a struggle with that person, and how maybe the neuro mapping goes to that region, and how we might be able to influence it to kind of better the health of that person.
Okay. So before we get into chiropractic care in cancer care, maybe give us a little bit of a scenario. I would imagine that one common complaint that people might approach you with would be low back pain.
Yeah, of course.
And how would you begin the process of doing your detective work
Sure.
before you figure out
Sure.
decide what to do to try to provide benefit through therapy?
Yeah. So if we took a typical low back pain case, what we'd want to do is figure out which of the systems we think are involved. So what's hurting? Where is it hurting? When does it hurt? What types of things make that better and worse? And all of those questions help us narrow down what structures could or could not be involved in that person's pain. And almost in a checklist fashion, you can start to rule in and rule out certain things. As an example, the most common thing I get told in the office is, I have a pinched nerve. And the fact of the matter is there's very little of that goes on in the human body.
Yeah. So instead of telling you the symptom, they're already jumping to the diagnosis.
Yep. So, I hear pinched nerve all day long. That actually happens very little, but people hurt a lot. And that's a very common thought is I hurt a lot, so I must have a pinched nerve. So certain things like that really come into play. Education is a huge thing. Really trying to teach the person why they hurt, what's going on. But more importantly, everyone wants to know, can we fix it and can we make it better, especially sooner rather than later?
So part of the detective work is a conversation.
Yes.
Asking about symptoms, location, duration, sort of the character of the pain.
Yep.
And then part of your detective work is examination.
Yep. And there's kind of an old saying in physical diagnosis: the patient will tell you what's wrong with them if you just listen. And so a lot of it comes into that, really trying to listen, how it's important to them, how it affects them. And after we feel like we've gathered some good information, then yes, physical exam, I think, is the bread and butter of the profession, because the entire profession is hands-on all day long, every day. You're going to find that chiropractors have what they call just good hands. You can palpate, or you can feel very minute changes in the body. You can identify after a period of time, things will just really jump out at you. Tight muscles, areas of inflammation, nerves that seem like they're really inflamed. Those are all things that you really can feel after a period of time, and that becomes, your hands become your best tool that you have.
So, as we said, you're have a private practice.
Yes, sir.
And you happen to be in the same building that our cancer
Yes.
center is.
Yes.
And so when we created the integrative medicine program, and for those who don't know, integrative medicine is a term sometimes people call alternative medicine or complementary medicine. We really like the term integrative medicine.
Yeah.
So it's bringing practices into the cancer center. It's not either or. It's both the treatments that are designed to treat cancer, but also treatments that are designed to holistically improve the quality of life of patients.
Yep.
And one of those services is chiropractic. So we talked to Blake, and so for a couple of days a week, he comes up and provides chiropractic care for our cancer patients.
Yeah.
So tell us what that experience has been like. I mean, you've been a chiropractor for over 10 years.
Yeah.
You have your own practice. And how would you compare and contrast the patients that we're providing you up in the cancer center?
Yeah, I think with all patients, especially if you're meeting them for the first time, one of the most important things is just figuring out what is that patient's goal. And that could vary from person to person in a very wide way. You know, one person's goal might be they're a marathon runner and they got to be able to get back to 26.2, you know, on the feet. Whereas another person, their goal might just be to stay independent in their home. Their goal might just be to be able to kind of get around their home, you know, without assistance. So kind of nailing down what that goal is really important. So in the cancer center, I think this is a great example of this. People have different goals than what you might, you know, think going in. And a lot of times, if you break care down into little chunks, it becomes very achievable little goals. So for a lot of the cancer patients, especially if they're actively being treated for cancer, if their goal is just to stay mobile, you know, to stay independent, that's a really great goal. That's something that we can definitely work on, and that may contrast with someone else, like I said, who could be a marathon runner. And then, of course, certainly once you get past care, past treatment, past that phase, those goals may change. And I think that's a great thing and something that you can always work toward is that next new goal.
Yeah. So some of the patients that I refer to you in the cancer center might have very specific symptoms related to their cancer treatment.
Yes.
So, for example, they may have physical symptoms and or limitations related to surgery or radiation or chemotherapy-induced neuropathy.
Yes.
Where we're asking you, okay, Blake, can you help with peripheral neuropathy? Others may have cancer, but there's athletes and have the same sorts of aches and pains and stiffness and as others. So we obviously don't limit the care that you provide to just taking care of side effects of cancer treatment.
Yeah.
How would you approach, let's say, for example, peripheral neuropathy that is caused by chemotherapy as opposed to peripheral neuropathy caused by an injury?
Yeah, that's where a lot of those cases, some of what we call the soft tissue modalities, or if I kind of break chiropractic up into the traditional component that just about everybody knows of to some degree, the spinal manipulation, everybody knows kind of, at least to some degree, that chiropractors do that. So that's very traditional chiropractic. But the patient that you just brought up with the neuropathy, that's where some of these other soft tissue modalities really shine. So peripheral neuropathy, what do you actually have there? Well, you have a soft tissue or a nerve, muscle, tendon type of pain syndrome. So some of these hands-on therapies that focus on those soft tissues or those muscles, tendons, painful sites really can do well with that hands-on care.
Yeah. I saw a patient today that you had worked on a couple of times, and she's had very significant improvement. And as you describe what you did, it comes to mind like she thought you were going to be like cracking her back.
Yeah.
Now, obviously, that's, you get that. And she thought, and she was just surprised that you were focusing on techniques that she considered more like massage. And provided her great benefit because she was a little uncertain about how this was going to play out, and was very pleased and surprised by the approach.
Yes. Yeah. And that's where, if we kind of bring it full circle, where kind of that initial detective stage is really important, because a lot of the neuropathy specific patients that we see, you know, are surprised when I start really trying to get in there with, you know, where is the neuropathy specifically, because those answers matter. It's not just, you know, neuropathy of the legs or neuropathy of the feet. I want to know where, I want to know which toes, which part of the foot, because what that allows us to do is really kind of trace that anatomy back and focus our energies into the place that really should make a difference.
Yeah. So as you mentioned, somebody could have a ruptured disc where it really is a disc pinching a nerve up in the spine.
Yes.
But with the chemotherapy induced neuropathy, it's not the same thing.
No.
It's the effect of
Yes.
the drugs on the nerves and the nerve endings.
Yes.
It's a different treatment.
Yep.
Maybe describe a little bit some of the experiences that you have had with patients in the cancer center and specific symptoms that they have had that have either been related to their cancer or their cancer treatment, and ways in which you have approached their care.
Yeah, so a lot of the patients that we see, so if we maybe hone in on, say, a breast cancer patient who's had surgery, that's a great example of someone who's had surgical alteration of the tissues on front of the chest wall, and that can really create a scenario where you can have some chronic pain associated with the change of those tissues,
and especially if somebody's had surgery and then radiation.
Correct.
And the sort of the scarring and fibrosis that happens after that.
So those types of conditions, again, generally do pretty well with some of these hands-on myofascial approaches, because if we can get in there in a really specific way and provide some corrective myofascial care to a lot of those tissues, you can really get those tissues to mechanically function better, and then also kind of get the body to readdress that area. And that's the way I like to describe it, is kind of the body brings attention to that area again. And we're going to really work to try to, one, kind of mechanically improve the functionality of those tissues, but two, try to get them to heal again, try to, stimulate some healing of those tissues by restoring that normal function.
So one common side effect for women who've undergone breast surgery, especially surgery that included removing of the lymph nodes and radiation, is lymphedema or swelling of the arm. There's a well-known occupational therapy type of program that deals with lymphedema, but I've come to learn that other practitioners of different ways, different healing arts, including chiropractic care, can have benefit in lymphedema.
Yes.
Maybe talk a little bit about the role of chiropractic care in treating lymphedema.
Yeah, so lymphedema, especially obviously in the cancer center, is something we see a lot of, and that where that can really shine, or the profession can shine, again, comes back to kind of that anatomy, understanding maybe some where of those lymph nodes have been removed, what structures that may impact, and again, allows us to kind of jump in a hands-on way to see how can we improve this region, how can we improve this symptom in a way that's beneficial for the patient. So it comes back to just the hands-on training, the hands-on comfort, knowing what you're working on, and kind of going in with an objective in mind. So a lot of those lymphedemas can and do see a lot of benefit from manual therapies.
Yeah. When I've talked to cancer patients that have maybe gone out into the community, let's say to go see a massage therapist, and there's lots of good massage therapists out in the community. You don't need a referral. Insurance generally doesn't pay for it. You just go find one. But if you go in and say, well, I've had my breast removed and reconstruction and radiation lymphedema, they're more likely than not to say, well, I'm not going to work on that, but where else should we work? Right. One of the things that I like about our integrative approach is that before you see the patient, you and I have gone over the patient's history, what they've had for surgery, where they've had radiation, and our experience is the massage therapist, the chiropractor, and the acupuncturist. We do it in an integrative fashion. There's less fear of, well, I'm not going to do that. We understand that the services you provide can be provided on the site of the body where they've had cancer treatment.
Yep. And I think there's a lot of comfort with patients in having that integrative, all-in-one place approach, because what it allows me to say is not, I'm sure there's a X provider in a neighborhood that would do a great job, but rather, hey, go see so-and-so. Hey, their room is right next to mine. We can talk with them. We can say, this is what we're trying to accomplish. The integrative approach is between the chiropractic, the massage, and the acupuncture. everybody shines in their own way. So what it allows me to say, and I say this a lot, is, hey, needling will be perfect in this region. That's something that would really help. Or massage therapist, maybe they can really spend a lot of time right in this spot, and that is of huge benefit.
Yeah.
Yep.
And obviously also integrating it with the medical doctor care.
Oh, the guy in charge of it. Yes.
No, not in charge. We share the patients, but and you probably hear this more than I do, but not every medical doctor is enthusiastic about sending their patients to see a chiropractor
Yes.
or an acupuncturist
Yes.
or a massage therapist.
Yes.
So learning the capabilities that you have with patients that I care a lot about, and it's been educational for me, and just been such a great opportunity to provide this sort of care for our patients.
Yep. Yeah, and I think a lot of that it really comes down to just kind of showing that, at least with my approach, is I want to jump in where I can in a certain place where I can, try to complete certain objectives, get that patient, to accomplish what it is that we're after, and then just being a kind of a piece to the puzzle. It's not meant to kind of be all encompassing, but rather just kind of providing a service where appropriate and where I think it can be beneficial.
So, Blake, as a cancer doctor who takes care of patients and has the opportunity to see patients time and time again through difficulties, I realize that the relationship, the doctor-patient relationship, is a huge part of the healing process. So the first time I see a cancer patient, I might spend a half hour just talking, and I don't know if the way that a chiropractor's practice is set up, where a great deal of the time needs to be hands-on.
Yes.
How do you figure out the talking part, the establishing of a relationship?
Yes.
that can actually then improve the therapeutic response to the actual treatment? How do you approach getting to know a patient?
Yes.
The first time you meet them,
Yes.
getting to know not only, in our setting, what they had for cancer, what the treatment was, but who they are and what makes them tick.
Right. Yeah, I think in my case, one of the most important things initially is just explaining what it is that we're going to try to do, why we're doing it, what the purpose of is, what we're doing, not only as a whole, but maybe just in that moment, why I want to put my hand here and feel this and see how this moves, explaining that. But I think one of the best ways to connect with patients in a hands-on profession is an old saying of quite simply just touching them where it hurts. So that person, you're acknowledging to that person, I understand this is right here. This is where you're having the pain. I'm going to try to do everything I can to make that spot better. And in my case, I think one of the best ways to establish that connection is try to provide beneficial care. If that person knows that day or the next day that they're feeling better and that things are on track, and that this person acknowledged what it is I'm struggling with, I think you start to build it that way over time, because a lot of what I do is, well, not a lot, almost exclusively what I do is hands-on. So trying to connect through that way is very important.
Mm-hmm. Yeah, and there's been lots of studies in medical care that procedures, interventions that require touch are more likely to be of benefit than just a doctor prescribing a pill.
Yes.
Where the doctor, we don't actually write piece of paper anymore. We put it in the computer,
right.
But the act of writing a piece of paper, prescription on a piece of paper, it doesn't have nearly the likelihood of providing benefit as something that involves a touch.
Yes. Yep.
Let's talk about other scenarios. So we talked a little bit about peripheral neuropathy.
Yeah.
We talked a bit about a breast cancer patient who maybe had surgery, radiation, lymphedema. How about a head and neck cancer patient? So someone who had cancer of the back of the throat, perhaps an HPV positive throat cancer, squamous cell, where they got chemotherapy and radiation for 7 weeks. And one of the consequences is curing them of their cancer, but another consequence may be a loss of taste, loss of saliva, fibrosis, thickening, stiffness of the neck muscles.
Yes.
How would you approach chiropractic care for a head and neck cancer patient?
Yeah, and that's where my profession in this setting, you have to kind of do your due diligence, because with every cancer patient, there are going to be certain things I can do and certain things that I cannot do, just in terms of best practices. And so with that patient in particular, the one nice thing about the neck is you can work on it from a lot of different angles and directions, and there's a lot of different therapies that can be brought in. So how can we access some of those, say, deeper structures that maybe you can't quite get your hands right onto? And the benefit with that type of patient, like I said, there's a ton of hands-on modalities that allow access to different parts of the neck, just because you can get to it from all the way around. But additionally, what are some different types of joint therapies, mobilizations that can be done that are safe for that patient, but achieve that same result? So for that particular patient, that's what we're going to do. We're going to jump in with a kind of a hands-on approach into some of those structures we can access, and then explore some of our safe practices that would be just as efficient from a joint perspective.
Mm-hmm. So, for example, the joint, there's a joint in the jaw,
Yeah.
the temporomandibular joint.
Yeah.
And one of those lingering side effects may be limitation of range of motion of
Yes.
the TMJ, the
Yes.
joint of the
lower
jaw to the skull.
Yes. And have had some good opportunity to work on at least a few cases of that in the cancer center so far. And again, jaw's kind of that same way. You can really access lots of different areas of that mandible in a way that should allow for better restoration of chewing, opening and closing that jaw, and then certainly goal with pain reduction as well.
What are some of the other, as you think back on your experience over the last, we've been working together for about 4 months?
Yeah, a few months now. Yep.
Yeah. Some other scenarios with cancer patients that you've had the opportunity to serve.
Yeah, so we covered the neuropathies, a lot of the breast cancers. I've seen a lot of folks that are in kind of that survivorship portion where their treatment was maybe multiple years ago, and just kind of having your just garden variety neck and back pain. So those are, of course, are kind of the bread and butter. But yeah, I've seen what was some cases we've seen here. I take a lot of special interest in some of those spine cases that the cancer has affected areas of the spine, because the spine for me is always going to be like coming home, in the area that you have the most extensive training in. So I do have some interest in looking at some of those spine cases.
Yeah. So a couple that I can think of. So one would be there are many patients that have stage 4 cancer, and a couple of scenarios would be a woman with breast cancer. She may have estrogen receptor positive breast cancer, and the cancer has spread into the bones, or a gentleman with prostate cancer with the cancer spread into the bones.
Yep.
And sometimes it could be many bones involved.
Yep.
And so I know lots of doctors who say, well, we're not going to let a chiropractor even in the same room with somebody who has cancer in the bones.
Yes.
But I know that there's a lots of touch therapies that can help provide them benefit. How do you approach when I show you the bone scan or the PET scan of somebody who has metastatic disease in their spine and has, general aches and pains, including some pain in the spine? What's your approach to providing chiropractic care on someone who has metastatic cancer in their spine?
Yeah, so metastatic cancer is going to be one of those where it brings us back to certain things that you want to do and certain things that you were just absolutely not going to do. And a lot of that has to do, the things that we're not going to do, are the ones that are a lot of those spinal manipulation techniques, just because you cannot predict what the response is going to be. And that's just that's not observing best practices. So the things that we're going to do is we're going to start in a very surface, low level way, and we're going to kind of make our way into some of the more deeper hands-on approaches, all of which are safe, but you always want to stop just short of what where you maybe could go. You want to stop just at that point where you're reaching therapeutic benefit for that person in a way that's safe.
Mhm.
Yep.
And have you had interactions where the patients are apprehensive? Do you, as you approach a certain part of the body?
You know, you try to, yes, you do try to explain things. You do try to exhibit just comfort. The thing that I've learned over the years is if you are confident in what you're doing, and you kind of just learn that calmness, that bedside manner, people generally are very okay with it. But the other thing that I've come across is the man in charge has recommended it, so they're usually pretty on board with anything that you've recommended to them. So,
and knowing you, Blake, I don't think you're someone who kind of sneaks up on somebody and goes, "Crack!"
no, no, definitely not.
That's probably
Yeah.
not the way chiropractic care is taught.
It is not. No, like I said, you really want to try to explain what it is we want to do, what we're trying to find, what we're after, and what our goal is with doing it.
Yeah. What would you say? What have you learned about life in the last few months by spending time in the cancer center?
I think back to the goals. Prior to doing this, I did not see anywhere, to the degree of, the percent of the cancer patients. I've always worked on people in various stages of cancer, undergoing treatment, previously treated, but really kind of understanding what those goals are with that patient, and really trying to take in how can I help them, even if it might seem insignificant to somebody else, it might be very significant to that person. So how can I help facilitate that?
And as we mentioned in our cancer center, our integrative medicine program right now includes not only chiropractic care, but also massage therapy and acupuncture.
Yep.
How would you compare and contrast just those three modalities of care, and where might you think that one might have benefit over another?
Yeah. So we'll start with acupuncture. Where an acupuncturist, I think, can really shine is that they are using a device that is piercing the surface of the body, and the ability to direct that needle down to a specific tissue is something that I'm only working from the outside, and despite people who've been in my office and know that these hands can sometimes get in there pretty deep. It's certainly,
you don't actually pierce the skin.
It's not piercing the skin
with your fingers.
So the ability to use those needles to help regulate different body systems, or help control pain, nausea, some of those common ones that you'll see in the cancer center. That is where that modality really can shine. And I'm probably selling short, everything that acupuncture is capable of doing, but that would be the primary difference. Massage would be about the only profession that you'd find that would kind of rank right up there with chiropractic, for your hands are on people all day, and your ability to sense things, feel changes, not only within a visit, but maybe visit to visit, how that person is responding. Massage therapists really can shine in that they're that hands-on profession, and can generally really spend a lot of time working on things. So that is certainly a plus there. And a lot of massage therapists tend to just be I think very in tune with their patients. I always joke that I'm kind of hard-headed, but massage therapists generally do a really good job connecting with their patients as well. So I think that's also certainly a region where they can shine.
You talked about multiple visits. So in your general practice,
Yeah.
what would be the average number of times a patient might come for care?
So in my office, across the board, the number is under 4. for any particular complaint. It really just depends what you're getting into. Certainly, there's a whole host of visits that you'll just see somebody one time and they'll be in good shape maybe after a day or so. And then you can get into conditions that are far more care intensive, could require 8-10 visits to feel better. But yeah, generally under 4 is about that average. And that usually serves as a good number to clinically know if what you're doing is effective, if you're making the change that you're looking for, and obviously if that patient is responding, because at the end of the day, it's that functional improvement we're after. Whether it's just I can sit 30 minutes now and I can only sit 5 when we started, or someone who's very active with, may say, their occupation and they can stand somewhere for 2 hours, whereas they couldn't stand that long before. So those functional improvements are always what we're after.
So every profession changes over time.
Yep.
I graduated from medical school in 1980. So, we're talking 42 years. The way that I do radiation treatments now has changed significantly.
Yep.
How has chiropractic care changed during your professional lifetime?
Yes.
And what excites you about the future of chiropractic care?
I think what's really changing in the profession is you're seeing the integration. So centers like the Cancer Center are bringing the chiropractic in. I've been able to be part of the MercyOne Comfort Health Center for Women for the last 5 years. So they about 5 years ago brought that piece in as well when they started that office. But within the profession, the number of therapies and modalities is really expanding. Chiropractic, the foundation will always be that spinal manipulation piece, but being able to bring in some of those other modalities that are shown to be effective for whichever condition is they're most appropriately for treating. But
and what are some of those?
Yeah, so the hands-on modalities, so some of those myofascial release techniques. So what does that mean? Just hands-on deep tissue work.
Mm-hmm.
There's a lot of instrument-assisted techniques. A lot of chiropractors, including myself, get into some of the rehab things that might complement.
Instrument assisted?
Yeah, so what that would mean is you might have a set of kind of handheld tools that you can use to work through some of the joints, say a tennis elbow or a frozen shoulder, that really are just a complementary way.
Vibrating?
No, so a lot of what they are just kind of a stainless steel set of stationary tools that have various shapes to them that might best accommodate a certain joint.
Gotcha. So you can get more focused pressure into a given plane, a tissue plane, or
Yep. So what that allows is working on tissues either more specifically or more appropriately based on that joint shape or size. So those are a lot of those hands-on modalities are important, but a lot of the chiropractors out there too have really embraced some of the technologies that are now available, be it different imaging technologies or technologies that allow you to more specifically, analyze different conditions in a way that can help facilitate care.
So I know that many chiropractors are also promoting themselves as being part of a healthy lifestyle, and as you mentioned, the fundamental part of chiropractic care is spinal care and spinal manipulation, but are extending out into talking about diet and nutrition, physical activity, sort of those healthy lifestyles. Is that something that there was a focus on in your education, and where do you see the profession going as it perhaps expands beyond the basics of what we've thought chiropractic care is?
Yeah, so chiropractic just fundamentally has always focused on the whole health of the person, and you really can't promote that without looking at a lot of the nutritional world, a lot of the exercise world. So a lot of the chiropractors, including myself, do take special interest in things like nutrition, because like I say, you really just can't say you're a whole health provider if you're ignoring a lot of these other things. So the benefit of good sleep, nutrition, hydration, and some of those things are really the fundamental components to healthy living. So yes, those are things that are part of the training already, but nutrition is one of the fastest expanding just segments of healthcare in general. Always learning things about different vitamins, supplements, or just diets out there that might help promote just health as a whole. Yeah.
Anything else about chiropractic care? What are some myths that you would like to dispel? You don't walk on people's backs, right?
No, no. Some of the common ones that I hear are once you start, you'll never stop. Once you go in, you're going to get roped into never-ending care plans. At least in my office and in a lot of them, that isn't true. Another common one is that joint manipulation causes arthritis. That's also not true. So unfortunately, I'm sure that can happen in places, but most of the profession does not prescribe to those approaches.
Good. Well, let's open up to questions. So we've got a live studio audience here that is very lively. So we'll get some questions. And if you're live streaming us online, please just put the questions into the chat box and we'll get to them. So let's start over here.
Blake, so you talked about you see cancer survivors at the Ruptured Disc clinic. Now, caretakers, if they would like to come see you, do they need a referral from their doctor?
The answer, 99% of the time is no. There are just very few select health plans out there that require that, but it's so overwhelmingly no. I generally just say no. If that is the case, then something that can usually be taken care of, but almost always no.
So in general, anybody can come and see a chiropractor. Yep. You do not need a referral. No. But part of that answer also comes to who's paying for it.
Correct.
So I think what you're saying is that most health plans that pay for chiropractic care don't require that a MD or DO or a more conventional provider actually make the referral.
Correct. And to expand on that, almost every health plan now has chiropractic coverage on them. I very rarely find any that do not. So that is always the next question is yes, it is. Usually a covered service, just subject to whatever the policy has for benefits.
So, for example, traditional Medicare, does that cover?
It does, yes. Yes. Traditional Medicare covers at the standard 80% that you'll see for all Part B coverage. Mm-hmm. Yep.
Okay. Other questions?
Hi, Doc.
Hi, Mr. Rebelski.
No, it's Rebel
Rebelski.
Talking about chiropractors, I've never really had really good luck with them.
Yep.
I had one chiropractor. I won't state his name because it wouldn't be fair, but I went to him for neuropathy, and I kept noticing that none of the help were wearing masks. So I asked him, why don't you wear masks? He says, well, by HIPAA regulations, I don't have to answer that question. I said, have you had your shots? He said, don't you know that your shots mess up with your DNA? I mean, talk about a guy that didn't know his you know what, okay? But then I had another chiropractor, and I'm not trying to bring you down here, okay? I think you guys have a specific place. But another chiropractor, I had a fifth vertebra. I had fifth tip vertebra.
Okay.
And I had surgery, 2 rods on my back, 6 screws total. And when I was going to this guy, my hips weren't working correctly. They were getting fatigued. I couldn't walk very far or whatever. And he said, oh yeah, we can take care of that. That's no problem. Then as he looked, he said, well, you didn't have to go have surgery for that fifth tip vertebra. I could have fixed that on its own. You wouldn't have to go off that surgery. Whether he's right, wrong, or indifferent, I don't know. But anyway, I went with him about 4 times and I said, no, this isn't the guy for me.
Sure.
I also have neuropathy, and I have peripheral neuropathy. And now I'm going and I'm taking what I want to say, a way to start relieving. I don't have pain. I just have, you just have that numbness. And I'm finding that to maybe help. I'm not sure, but my, neuropathy, as you well know, really messes up your being able to keep your balance a lot of times. Okay. So when you talked about neuropathy, you used the word pain. Now, I didn't have any pain. Other people do have pain. But would you recommend that in that type of situation that, your feet felt like, you were in a boot, okay? How would you approach that? Let's say, for example, with me, how would you approach that to say maybe how you maybe can help me?
Yeah. So when I say pain, that's probably a term that's just easy to use. Nerves have multiple functions beyond just pain sensation. Nerves are involved in a wide array, of regulatory things within the body, and they transmit a lot of different types of signals. So one of the neuropathy patients that I have currently been working on describes her neuropathy as she feels like there is a ball under her foot. So it's not in her, in this lady's case, it's not pain in her case either. It's just an alteration of what you would just call normal sensation. So it really, what that comes down to, again, is trying to trace back which of these nerves are transmitting those signals, and can we provide care in a way that's targeted towards those nerves that helps stimulate those nerves, helps re-regulate the signaling within those nerves to reduce that boot sensation that you're describing.
For example, I've found that since I've had neuropathy, almost every chiropractor you hear is getting into the neuropathy business. You see these on the TV constantly.
Yes.
Okay.
Yes.
And I'm trying to think here.
And it's not only chiropractors. You look through the Sunday paper, and
right, exactly.
So it's come to
you're right.
My belief that probably it's an aging process, and that there are so many of us baby boomers that are going to be getting our neuropathy, that there's neuropathy clinics just springing up everywhere.
That brings up another point for me.
So maybe the question for Blake, since this is a question and answer session, is, Blake, what do you think? Where do you think the world is going with the neuropathy? And do you think, what's your thoughts when you look through the newspaper? You see all of these clinics that are advertising all the various ways. Some are electrical and some are magnetic, and some are, they tend to be
light based.
Very IT gizmo focused.
I think that's the way to say it is technology is really working hard to try to solve neuropathy, and I think you're seeing a lot of new technologies that are attempting to stimulate nerve healing, nerve function, be it through signaling, be it through light therapy. A lot of these technologies are new. I think a lot of them are, what's the right word? A lot of them are still, I think, yet to be established as real sound practices for neuropathy. I think a lot of them, people do have success with these various therapies, but for like most things, time will tell which of them I think really stand out as being effective.
I think as a scientist, we're always healthy skeptical in a healthy way,
Yep.
cynical in a healthy way, you know, prove it. But there must have been like these treatments must have been fast tracked for FDA approval or for Medicare approval, because I gather that maybe they're reimbursable. And so they must have had some evidence to be able to get to the point that they've fallen under the definition of being medical necessity and having proven safety and efficacy.
Yes, the ones that are, yes, would be reimbursable and would be to that level. Others are not.
So some of them
very much are paid out of pocket. Yes,
because they haven't been proven to be beneficial.
Correct.
Okay.
Yes. Yep.
Another question from our audience.
I had a totally different experience. I would be at work, and I was quite a few years ago, but after about 2 months of stepping out of my chair and not being able to take a step, my coworker said, "Call Casey Core, go see Blake." So I did, and he released myofascia out of my pain in my butt that I had. And I think I saw you twice in like 4 years, but put that together with PT and strengthening my muscles, I did not have to go back. Unfortunately for you, I will be calling Dr. Deming to get appointments because now I'm really messed up. So it is not all about just cracking the back. And it is also, you kind of have to change your lifestyle if you want a different outcome. You can't keep doing the exact same thing. So I have to stand now at work instead of sit all day. And so it's kind of a combination. But
well, and I think that's one of the things that I like most about what I do, and that you don't come to my office unless generally you're looking for some type of change. I generally get in my office, if we just look at the patient population as a whole, people who are looking to put in some kind of effort to feel better. They're looking for corrective care, because really otherwise you probably aren't going to find my office or chiropractic in general. So that's generally the rewarding thing about working with patients in my office, is most people have a lot of self-interest in care and improvement.
Gotcha. So you don't get a lot who just thinks you're just going to make it all better just by what you do.
Yes.
They want to be an active
And they want to be
participant
involved.
in
Yep.
their health.
Yep.
Okay. Jim.
Hello, Blake. Tonight I learned a lot about chiropractic things that I didn't know before. I always thought it was your back being cracked and pretty much that's it, but it isn't. It's about your skeletal system. It's about your nervous system, lymphatic systems. I'm going to go one step further here. The other system that's big in your body is your circulatory system.
Yeah.
So what is the link between chiropractic care and your circulatory system?
So I can really give you two. The real traditional link would be the nervous system's role in blood flow throughout the body. The other one would be some of the hands-on conditions that we see respond very well to some of the circulatory systems. So when we see conditions that are a direct result of diminished blood flow to an area, or a compression that causes, say, numbness into a hand or a foot. A lot of those circulatory conditions, if they're one that fits well into the musculoskeletal space, can respond well. So if we look at some common hand numbness conditions, can do really well with some of these therapies as well. But to answer your question, it would be the nervous system's role in regulatory of the circulatory system in the body.
So various ways that the nerves can cause either dilation or constriction that happens through the nervous system. Yep. With their impact on the blood vessels.
Yes.
And then, so how about bicycle hand numbness?
That's a good one.
We have another question.
Hi, Blake. I've had really great luck with chiropractic care, but since my cancer treatment, I am unable to lay on my stomach, and
Yes.
most of my care was done on my stomach. What are some ways that you can do that? Because now I'm very frightened to go to a chiropractor because of those limitations. So what are things you can do at the cancer center to alleviate those positions?
Yeah, so a lot of specifically with what I do, can either be done face up, so still laying down, but maybe face up, or in a seated position. And if you get that real occasional person that throws you, sometimes you're just going to work with that patient and figure out, okay, what can we do here, and what is going to be an approach that we can take that's going to work. But I'm going to say the vast majority of what I can do really can be done either laying on your back or just frankly just seated, and that allows almost everything to be accomplished just the same. But anybody who's been in my office knows they would spend as much time on their side as they do face down, or on their back. So it's something that is very easily worked around. Yep.
We got time for one more question. Do we have any from our live streaming guests? Okay. One last question. Poon, you get the last question.
How can you help cancer patient with sleep?
What's the role of chiropractic care in improving sleep?
I'm going to answer your question with another question. Sleep due to what would be inhibiting that sleep?
So one answer is hot flashes.
Yeah.
Another, fear of recurrence.
Yeah.
Another might be, my back hurts so bad I can't get in a comfortable position.
Yep.
So each of those might have a different remedy.
And that third category is going to just generally be the easiest, because again, it's kind of the bread and butter. Anything that's pain based can usually be made better and can respond well. A lot of that, the second category you mentioned, I do hear a lot of some of that, just kind of keeps you up at night thought. And that's really what comes back to taking care of the whole person, whole body health, exercise, hydration, nutrition. Maybe the best thing I can do for that patient is nothing physical. Maybe that comes back to the conversation that you mentioned earlier. Maybe we can bring in some good nutritional components and some exercise that help regulate the body
some
systems.
mindfulness.
Yes, exactly. That it really play a great role in just establishing that normal everyday rhythm for the body and allow it to rest.
Great. So thank you, Blake. Dr. Blake Myers, chiropractor. He has a private practice, KC Core Chiropractics, and he also practices chiropractic care at the Richard Deming Cancer Center, part of our integrative medicine program for cancer patients. So thanks so much for being with us. Thanks for joining us. If you know someone who would benefit by listening to this program, tomorrow it'll be available on demand at the Above and Beyond Cancer YouTube channel, and also be at the Mercy Cancer Center website, so you can listen again. Please join us again next week. Thanks for joining us. Thanks, everybody.